Thank you for inviting me to present today. First, I would like to acknowledge that I am presenting from the land of the Ghana people. Therefore, I pay my respects to their elders, past, present, and emerging leadership. I would like to also recognize their cultural heritage, their belief, and their relationship with the land, which continues to be of great importance for them now and into the future. I hope we can work together with respect for each other and their land. So I would like to introduce myself. I am Dr. Maria Alejandra Pinero de Plaza, and I am a research fellow at Flinders University, the College of Nursing and Health and Sciences, and my work is driven by my passion for creating health interventions that foster inclusion, voice, and well-being, particularly for underserved population. I draw from my expertise and experience in mixed methods research design, experimental design, and evaluation, and I lead transdisciplinary initiatives that bring together researchers, clinicians, industry, and consumers to tackle complex health challenges. So my passion is about involving people affected with lived experiences. They call themselves consumers as co-researchers, so that we can recognize their invaluable collaboration and input into developing evidence-based solutions that address the intricate and adaptive nature of the healthcare challenges that we are facing today. So this collaborative process, I believe, help us to synthesize insight, to create innovative solutions that gather insights from different disciplines and help us to create solutions that are deeply rooted in the life experiences of those who are facing these challenges and those who are there and want to make a difference in the world. So my investigations span across different areas, from evaluating artificial intelligence to improve healthcare, investigating virtual care models, comprehending and addressing the relationship and interconnections that create healthcare networks, and understanding how those networks can be leveraged and embedded into the care of people, the care that our services provide across the life course. My work in the area of the homebound people, we call it a program. It's a program of research that is called the Frail, Homebound and Bedridden People program, that has been developed and co-developed by the big group of transdisciplinary researchers looking to get significant advancements in healthcare services. Through this effort, we strive to ensure the healthcare system are equitable, are inclusive, are effective, and are making meaningful impact for public health. So with this presentation, I will be discussing the transformative potential that telehealth has in addressing healthcare needs of homebound individuals, a population that often experience significant barriers to traditional healthcare access. So telehealth is defined as the use of digital technologies to deliver healthcare services and information remotely. And as we have experienced with COVID-19, it has revolutionized the way that we think about care delivery, particularly for those who are homebound, basically people that cannot leave their home because of health reasons, psychosocial reasons, and so leaving their homes represent a very big challenge for their health, their emotion, etc. So in the literature and even in the media, We all know that telehealth seems to be a critical tool for individuals who are homebound due to chronic illnesses, disabilities, or other type of barriers. These individuals, like I said, often face multiple challenges, including social isolation, limited healthcare access, economic difficulties, profoundly affecting their overall health. So traditional healthcare models, as we know them, are not always well equipped to support these complex needs, making telehealth a promising alternative. So globally, the challenges faced by homebound populations are significantly impacting them, and this is something that is growing globally. For example, in the United States, the prevalence of homebound adults aged 70 or older have more than doubled between 2011 and 2020, with notable disparities among different racial and ethnicity groups. And so these individuals often experience, again, poor health, limited access to technology, unfortunately, and crowded living conditions, which further complicate their healthcare needs. In Australia, unfortunately, we don't formally collect data about homebound people, but our research group in their initiative have discovered the homebound seems or is perceived as a sparse group, but in the survey of the Australian Bureau of Statistics, the 2018 survey of disability, aging and carers, we found that a significant number of people living with disability do not leave their home as often as they would like to due to their health conditions or other barriers. So our research in this area, in a survey that we did around 300 people in Australia on the year 2020, we found that our Australian demographic is different to the United States. The characteristics of our homebound Australians are showing a relatively young population group, and by young I mean younger than 50, with a high prevalence of chronic condition, 3 or more chronic conditions. Among of them, the majority of them reported be living with ME/CFS or myalgic encephalomyelitis chronic fatigue syndrome. So for our local challenges, we do believe that telehealth it could be identified as a potential solution to address the disparities faced by homebound people. If you review the literature, you will find the research has shown that telehealth can effectively manage chronic conditions like Alzheimer's, is helpful in managing cardiovascular diseases, depression, while also helping mitigating social isolation and loneliness. We experienced this during the COVID-19 pandemic when telehealth became an essential service for older adults and everyone else, helping them maintain their access to care while minimizing the risk associated with in-person visits. So from this global experience of using telehealth to communicate and connect, and even during the COVID-19 pandemics, as we saw many people had contacts and access to their GPs, we will think that there are no difficulties or there are not problems to utilize telehealth. But unfortunately, current policies in countries like Australia restrict telehealth access to those who have not been in an in-person consultation with their general practitioner. And this is a limitation that disproportionately affects people. They are the most vulnerable people of our society. Amongst them, we have the frail, homebound, and bedridden people. So existing research often takes a disease-fragmented approach, and the problem is that we see these sectors, if we separate people by their diseases, we will find the homebound population into a minority niche. But in reality, as we talk, I have presented before, we are talking about a gigantic group of people with different conditions that live within the boundaries of their home. So there is a pressing need for more comprehensive research that evaluate telehealth as a holistic solution, and that's what we found. We found that we need to create evidence and demonstrate that telehealth could be a solution for homebound people. So we created our transdisciplinary group, and we decided to investigate the published evidence, quantifiable, with our consumers co-researchers alongside with us, with clinicians, with other experts from different disciplines, to ensure that if we to analyze the evidence and decide if in fact telehealth interventions are effective, equitable, or tailored to the needs of these communities, these frail, homebound, and bedridden communities. So in that, with that intention, we created a systematic literature review and meta-analysis of all published studies around telehealth and homebound populations. And we found that telehealth can significantly reduce healthcare utilization, including emergency departments visits and hospitalization. We also have found that it improves health-related quality of life, particularly regarding mental health, social functioning, and general well-being. Additionally, we also found that telehealth has been demonstrated to improve overall well-being, reducing depression, loneliness, and social isolation and anxiety amongst homebound individuals. So these findings, they are at the moment under review, are underscoring the importance of integrating telehealth into standard care practices for people that are homebound, so that they have access to it without necessarily leaving their houses. So after all this work, they involve the systematic literature review and meta-analysis, but also after collaborating with consumers co-researchers that have created all these recommendations that are listed here beside my image, we understand that to maximize the benefits of telehealth, it is crucial to tailor services to the specific needs of homebound people. This includes addressing the digital divide, ensuring culturally sensitive care, involving homebound people in the co-design of the telehealth services that we are going to offer to them. We need practitioners to be educated on the use of telehealth, and an effort should be made to ensure that these services are accessible to all, regardless of the socioeconomic status, geographic location, and specific disease that leave people homebound. So policymakers must also play a key role in promoting telehealth as a standard care modality. This involves investing in the necessary infrastructures, setting standards for telehealth quality and security, and addressing legislative and reimbursement barriers. Why? Because we have demonstrated in our studies that this will save resources as well. So by doing so, we can ensure that telehealth becomes a sustainable and effective solution for meeting the complex healthcare needs of homebound people, but also supporting other sectors and preventive healthcare utilization, prevention of these extreme cases that we are facing now because we are not taking preventative measures. So in conclusion, something has to be really clear. Telehealth offers a powerful tool to address healthcare disparities faced by homebound individuals. While there are challenges and research gaps about the way to address, to utilize telehealth, the evidence supports that telehealth has immense potential to improve healthcare access, quality of life, and overall well-being for homebound populations. So as we move forward, it is essential that we continue to refine and expand telehealth services, ensuring that they are inclusive, equitable, and responsive to the diverse needs of homebound people. So this presentation that brings a little bit of the view, academic view of the gap around telehealth is also complemented by the experience and understanding of our consumer co-researcher, Penelope McMillan. So Penelope will complement this presentation by presenting her experience working with our transdisciplinary team and also reflecting on the importance of creating projects in which consumers, policymakers, educators, all sorts of sectors and knowledge get together to make research that is transferable, that is applicable, and they have a high probability of having a social impact. So we look forward to any of the questions that you might have, and we thank you very much for your attention.